cancer affects not only the patient, but the whole family. Gabby was 11 years old when she started having trouble completing everyday tasks.
And it was really snowing very hard, and we went to the doctor, we got a CBC, and they said, okay, you'll have the results by Friday. And just trying to get out of the parking lot of the doctor's office took us like an hour. It was just snowing so much.
The lab technicians ended up stuck in the lab because of the snow, and they managed to do her test early, and they noticed she had what was your hemoglobin, 2?
It was 2.
It was 2.
Gabby received her first cancer diagnosis.
They thought that if we had waited till Friday, that I likely wouldn't have made it to that Friday and maybe not even through that night.
Before I knew it, she was being rushed into an ambulance. Mom was going with her, and they just went off to the hospital and left Dad and I behind. And I looked out the window a lot that day, and I remember the one tree back there was just covered in ice, and it was just so pretty, and Gabby wasn't there to share it with. And I think I remember that more than the actual diagnosis.
After her cancer diagnosis, Gabby was referred to a Valerie Fund Center close to her home, where she received individualized care from a team of social workers, child life specialists, educational liaisons, psychologists, and child life specialists. Valerie Fund Centers are found in 7 children's hospitals throughout New York, New Jersey, and Metro Philadelphia.
And when Gabby was first diagnosed, in those first days we spent in the hospital, we felt like we met 200 people that were on our side. And they were our closest warrior friends and on the front line.
The Valerie Fund treats children with blood disorders as well. These families rely on us for the duration of childhood, like Zion's family.
When they told me that my son had sickle cell, and the doctors, all I could do was break down and cry. I called my husband, he was at work, I was crying. You just think oh, this is not good, and it's gonna be the worst ever.
Our Valerie Fund centers treat thousands of babies and children with sickle cell disease, which can cause severe pain crisis consistent with the life-threatening condition.
The pain is usually worse in the leg because he can't move around.
No, every time I'm laying on my foot and my foot hurts, it just slows me down. It hurts very bad. Sometimes I walk inside and then go tell my mom or my dad.
First, the parent and later the patient must learn to manage sickle cell disease for the best long-term health outcomes. Through our sickle cell programs, child life specialists, social workers, and nurses teach patients, parents, and siblings how to identify symptoms and manage the disease.
Sometimes they usually give me shots.
Or blood work.
Yeah.
And seeing him crying and not being able to help him, the nurses really helped us by guiding us through it and what they had to do and stuff like that, so we can help him while they help him.
He's been through a whole lot.
The Valerie Fund supports nearly 6,000 children and families each year. Children like Abdil.
At the age of 3, he was diagnosed with ALL. I would take him to the park to play. He would fall. He started becoming sick. He'll have bruises on his legs. He started having nosebleeds.
With me, it felt like I wasn't sick, but at the same time, I knew I was sick.
Families receive support with comprehensive healthcare services, focusing on psychosocial programs for the patient and the whole family.
They explained to his brother Joshua the situation, what Abdil was going to be going through, that we weren't going to be alone, that they were there to help us out, and tried for Josh to understand what was happening.
Our social workers work with patients, parents, and siblings to minimize the emotional impact on the family.
He just wanted to see me in the hospital, make sure I was always okay.
It was hard for Josh. Joshua would think the worst. He thought his brother wasn't gonna make it. He was afraid. He would cry every day, worried about him.
The Valerie Emergency Fund was especially important this year as our families have been impacted by COVID.
I actually used to work with people with disabilities, and I had to make the choice to stop working, and I just didn't want to take the risk of bringing anything back home to my family, but especially Zion, because I didn't know how COVID would affect him with his sickle cell.
Abdil's whole family contracted COVID last year, and though he suffered from seizures, he is healthy now, but his grandparents did not make it.
We lived with my grandmother. She came out positive. She was a dialysis patient. She passed away. We had to move, and I reached out to the Valerie Fund for help. I didn't have enough for rent, and I didn't know who else to reach out to, and they helped us.
This year was also a difficult one for Gabby and her family, when during the pandemic, she had a cancerous ovarian tumor removed.
I don't feel guilty. I know that I couldn't help having cancer. It's not something I chose or that I could stop. But, it hurts knowing the effect that it has on others. Because, you don't want to hurt the people that you love. I am now lucky twice that I have survived and that I'm doing well and I have gotten through it. And I know that there are hundreds and thousands of kids who didn't get those chances, who didn't get to live their lives beyond childhood. And so I personally feel this sense of duty. I have to do something with my life. I can't just let it pass by. I have to do something, and I have to live my life, and I have to do as much as I can with it, because otherwise it would just be disrespectful to all the others who didn't get this chance and this opportunity. It feels good to talk about it, and in almost a space like this where it's like you have to talk about it.
Yes, and being able to share our story is a way of thanking the Valerie Fund for everything they've done for us and continue to do, and everything they do for families like ours.